Laura hasn't heard from him, so he may walk
In my
in.
opinion,
Impressed
at
with him.
least.
I was impressed with him as a, well,
What do the red lights mean?
Your mic's on track.
Oh, must be 5:30. Thank you, everybody, for coming to our joint City of East Wenatchee and Wenatchee, and I make sure I say East Wenatchee first,
Alphabetically, that's right.
which is great. The first thing we're going to do is our Pledge of Allegiance and then roll call. Councilmember Johnson, will you lead us in the Pledge of Allegiance, please?
I pledge allegiance to
the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Councilmember Johnson. Appreciate that. For the City of Wenatchee, we have everybody here. Great, thank you.
Okay, so for the city of East Wenatchee, I'm actually going to call out the council members so that I know there's guests in the audience, and sometimes it's nice to put faces and names together. So Councilmember Magdoff.
here.
Councilmember Arnold.
Here.
Councilmember Stockton.
Present.
And Councilmember Johnson.
Here.
And we are missing three of our other council members tonight, but maybe they thought it was the other side of the river. Maybe they'll join us later.
Patello, though, is not.
Oh, except for Councilmember Patello, yeah.
So we're here regarding the update to the plan to address homelessness. So who's our first staff member?
Good evening, mayors, members of the councils, and my name is Glenn DeVries. I'm the Community Development Director for the City of Wenatchee. And tonight, we'd like to give you an update of where we've been and where we're at with the Two City Homeless Program. Talk a little bit about the new staff position, the Homeless Response Administrator, and then give you an update on the pallet shelters, which just had some really good news in a text, so we'll talk about that. So back in October 2021, the City of Wenatchee entered into an interlocal agreement to manage the homeless funds on behalf of East Wenatchee and the City of Wenatchee. And we have been doing that with a quarter-time consultant and then my time to manage that program. It's been primarily focused on capital development for the two safe parks, and then also for the pallet shelter facility, and then program development for our 8 contracts. We facilitate and administer the Columbia River Homeless Task Force for the two cities, and also a shelter network group, which I'll talk a little bit more about what that is. And we coordinate with the regional meetings and systems as well, recognizing that we don't want to be siloed. We work within the system. We want to be effective and not duplicate services. We've really been focused on filling a gap in the system to that effect. Looking at when we originally started with the white paper and the study in the two cities, recognizing that we needed low barrier shelters, and there were none in the valley. And so to that effect, 204 low barrier shelter beds are now in the system where we had none before. And I can say as of tomorrow that it will be 204 beds. Because the pallet shelters will be done tomorrow as far as all the capital improvements. Also, we established 51 RV shelter stalls. It's a low barrier shelter system. Even though it's for RVs, it's the only one in the state that I'm aware of. And we worked hard with the state to establish it as such with wraparound services. So if you look at our overall system, again, we're part of a system here. It starts as a community approach, working with our other agencies and local providers, and then going down, we use local, state. Yes?
I'm just wondering if everybody behind you can hear you, because I can barely hear you.
Okay, let me see. Do I need to
Raise it up maybe, or point it up.
I think.
turn it up?
I think
Can you
Tim
hear
turned it up.
in the back? Yes.
Can folks hear
Yeah,
me?
We do have a few speakers back there. Okay.
Okay.
Thanks for letting us know. Appreciate that.
Thank you.
Okay. So we have a community-based approach, and we're leveraging state, local, and federal funds and trying to get people permanent housing who are unsheltered. And in doing so, we work with outreach systems. We have the Wenatchee Rescue Commission has 3 outreach workers, Catholic Charities, and then VCF also have outreach workers. And the idea is to connect people with services and get them into shelter or use diversion funds for an exit out of homelessness, and ultimately get them set up through coordinated entry where they can then access permanent housing and exit out of homelessness. So we were focused in the areas in red on that diagram. We are focused on outreach, partnering wraparound services, using diversion dollars and motel vouchers to exit people out of homelessness, and then the low barrier shelter development. Sorry, let's see here. My mouse isn't working. Oh, here we go. In doing so since October 2021, with the establishment of those shelters, we've managed to make some progress. In 2022, we had 113 unsheltered. This is through the point-in-time count that's done every January. In 2022, 61, and now in January of this year, 45. Now, this doesn't mean that right now, at this day and time, that there are only 45 unsheltered individuals in the 2 cities. There are seasonal fluctuations. These numbers aren't perfect, but the trend is a decrease because of the efforts of the 2 cities. And nationally, every year, numbers have gone up, but we are making progress. Additionally, say, for example, the People's Foundation at St. Francis, that is a night shelter. So individuals are out during the day from that shelter. So you will see more than 45, in the 2 communities, but we are making progress. On the system slide, it showed coordinated entry. This was a community housing network. The overall system operates a coordinated entry system. We started that in 2014 when we managed the overall 2-county program. It's a regional network of service agencies who provide coordinated access to housing and shelter for residents in the 2 counties. It's a requirement, a state and federal requirement, that be in place and the county have that system. We require all our contracts to use that system to sign people up, because you can't access housing unless you're signed up to that system. So it's really important. What's the role of Chelan County? In addition to administering and staffing that coordinated entry system, they manage homeless funds for both counties. They have 5 full-time employees, and they have administered this year, I think it was about $3.1 million annually, work with 11 agencies and 15 programs. They facilitate the Chelan Douglas Task Force and the Homeless Advisory Committee, in addition to a number of other committees. And then they coordinate the annual point-in-time count. So we began our process working with homelessness in the city of Wenatchee back in 2009, and between 2010 and 21, we administered the regional program. But a lot of studies were going on with ourselves, other agencies and partners in the valley, and really looking at this gap in the system, which were low barrier shelters and outreach, and wanting to make some progress on that. For that purpose, the city pulled out of administering the regional program, and the Chelan County took over, and we have been focused on a partnership with East Wenatchee to administer this program, focused initially now on our first phase on low barrier shelters and outreach. And in 2021, the beginning of that process, the Columbia River Homeless Task Force was started. So we have an interlocal agreement between these 2 cities. So for some of you, this is a repeat. For some of you, this may be new information as we have some new council members. So just briefly, the interlocal agreement, what does that do? It provides provides a framework for the joint administration of funds under the affordable housing sales tax for both cities, along with other funds that may be brought to them. This city of Wenatchee has added 2 additional funds. It's a commitment to joint planning for homeless policies and direction, establishes the Columbia River Homeless Task Force to provide recommendations on programs for the two cities, provides that the city of Wenatchee is the lead entity for the task force and joint homeless program, and we have responsibilities for the following: contract development, management, and performance monitoring, fiscal oversight, contract procedures and policies, meeting coordination and regional participation in the continuum of care, that overall system the Chelan County runs, communication and education efforts, new program plan and policy development, data collection and reporting, system collaboration and partnership development, and provides staffing as the lead entity. So those are the responsibilities and the agreements under the interlocal agreement that we work under. So we have three funding sources. One is the local option tax, and the city this year, tax revenues are estimated to be about $609,000 for East Wenatchee and about $1.6 million for Wenatchee. Those are our primary fund sources to administer this program from the locally adopted tax. However, we do have two funds we've added from the city of Wenatchee, which amount to $194,000 for use in that program. Sorry, my mouse isn't working. Okay, here we go. So we have a number of programs we administer. We have 8 contracts. We work with the Wenatchee Rescue Mission, People's Foundation, Women's Resource Center, YWCA, the Catholic Charities, and we have a variety of programs. We work with low barrier shelters. We support operational facilities for 2 different permanent supportive housing unit facilities. We have emergency hotel vouchers and diversion funds that we help fund as well. So after 3 years of doing this, we've established some facilities and programs and made some progress. We have 2 RV safe parks, low barrier shelters in themselves, providing 51 safe park spaces that can go up and down depending on the size of the RVs that come in. And as a result, we have a significant reduction in the number of unsheltered households and RVs on the streets. We have a total of 204 low barrier shelter beds as of tomorrow that are available. 43 of those are low barrier pallet shelter units. We've established a homeless outreach street program through the Wenatchee Rescue Mission in partnership with them. We have we have a hotel voucher flexible offending program. We've done a shelter outreach network group, which has really been beneficial. The shelter systems and the outreach workers come together and they problem solve and come up with ideas and how to share resources, and that's been a great tool to make progress. We've also done a shelter vacancy tracker, which I'm going to show you an example on what that means. A lot of collaboration with Chelan County on a variety of issues. And we're currently working on an outreach program based in our geographic information system that can help track data, questions, so that we can be a better meet the needs of folks on the street to try to get them out of their point of crisis. We can keep track of information as we're engaging them. A lot of talk about low barrier shelter, low barrier programs. What does that mean? It's a philosophy in which barriers and preconditions to entry are eliminated or minimized. It doesn't mean no rules, but it's a different form of rules. Project participation is based on realistic and clear expectations that are behavior-based rather than rule-based. Low barrier system is often applied to emergency shelters, but it can be other housing systems as well. Because it's behavior-based, there's a lot more staffing involved, but really this is engaging the folks with the highest needs on the streets, so it's a low barrier shelter system. This is that bed tracker that I mentioned. We're excited to have this online. So this is available to the shelters, so if they're full or if they have, each shelter meets different needs for different clients. So if they're full or they have someone who they can't incorporate but others can, they can look on a nightly basis and see what's available. It's also available to our law enforcement agencies in the 2 cities. They can check, and they're the ones out at night typically where other folks aren't. And if they have an individual who wants shelter, they can beds are reserved at our contracted shelter facilities, they can call them up, they can see if a spot's open, and then they can take them to the shelter. And we have reservations so that they can do that. As part of our responsibilities administering the program, we do contract monitoring. This ensures compliance, but it's a partnership. It allows for communication, education, and training. We learn from it, they do as well. We do a variety of things to do that. We're looking at our contracts, our detailed scopes of work. We have city housing contract guidelines, which are best management practices nationally. We have orientation meetings, we have a monitoring plan, we have a frequency of monitoring, and I'll show you some examples. We do everything from looking at data to going in the field, and then we do follow-up meetings as we do monitoring. Some of the things we're looking at doing, hopefully, that we want to keep working on doing better, and some of the things we look at doing in the future with our new position is we'll be going out in the field more. Having weekly meetings with a number of the providers. That's an opportunity to learn from each other and to try to make progress and improvements over time in partnership with the providers. We'll also be looking at, as we do updates to our contracts, one of the things the task force will be looking at is our metrics, our performance outcomes, and I'll talk a little bit about what that means in a minute. This is a sample monitoring schedule. It's not up to date, but I just wanted to show you here. If you look in the center, it says risk assessment, and you can see the upper one says 74. Having a high score doesn't mean anyone's doing a bad job. It means you have a complex program. It means you have a large program, or it means you have a new program. And so your frequency of visits, your level of monitoring increases because of that. And over time, it may or may not go down because of the complexity of the program, or it might. But we do an assessment of all the programs in that fashion. Okay, now performance targets that I mentioned. So each program has established performance targets, which are in their contracts. Over time, that will be changed and amended as we learn or think of new ways to better monitor and look at performance targets. And sorry, I'm just looking up front. I'm not going to try to flip side to side and look at folks, so sorry about that. I'd probably get dizzy. Each contracted program has an acceptable progress outcome, which is incorporated into their contracts. I'll show you some examples. Acceptable progress really can vary by program. And for new programs, you set baselines when you do these performance. And when you're starting a new program, you have to wait a while for the program to be in effect. And for some of our programs, we do have performance goals and things we're looking for, but we really kick in to some more detailed performance measures, and that will be done in this next contract cycle. We'll have some more data, we have programs in place, we've been monitoring, so we'll be really asking questions on what helps us evaluate the programs being successful. It's an ongoing dialogue. That isn't a one-time thing we do. Over time, we'll keep asking ourselves a better way to monitor those programs. And that's something that the task force helps the two cities do. This is just an example of a sample of performance metrics that were in last year. A lot of this data is entered into a state system. It's called HMIS. And then the county is very kind to us, and we request a special report, and they provide that to us. Our consultant's been working with the state to see if we can get more canned reports so that we can access this data on our own. Another item that we do is we do a lot of meetings, not all the time, but it's important to have communication and work together. It's important to try to improve service provisions. We realize that we can't solve the homeless problem on our own. We need partnerships. And one of the processes for that is our Shelter Outreach Network group, and it's been really good. We meet monthly typically. They help set the agenda, and we problem solve. We look at sharing resources, and it's been very beneficial. We also work with the county on their meeting systems for care conferencing, task force meetings, homeless advisory committee meetings, and it's really helpful to engage in the overall system. We have ongoing coordination on a monthly basis with the county. And we're continuing and we'll continue to work on the wraparound service provisions. We need those partnerships. And one of the things the county just granted us to be on the subcommittee for the development of the 5-year homeless plan for the overall system, which we're very appreciative of. And now that we have sort of the bones of the system set up in the last 3 years, we're now at a juncture where we can look at how can we implement the system better. And we've been looking at other jurisdictions and examples, and one of those is the city of Auburn. And Laura, would you like to speak to lessons learned and some items we'd like to move forward with?
Good evening, councils and mayors. Laura Gloria, I'm the city administrator. As Glenn mentioned, everything that you've heard up to date is sort of the bones and the structure, the infrastructure, the framework. But as we're moving forward into implementation of more things, it really was a time for the city to kind of take a look at the overall approach and what that might be moving forward. So reaching out to other cities, obviously every city is different, every challenge, every success in every city is different, but however, can we take bits and pieces and kind of form it to Wenatchee? So one of the cities that really stood out was the city of Auburn. They are having really good success with their program, and a big piece of it is the approach that they take to it, specifically that first bullet, which is field outreach. So having a position that is out in the field, coordinating with services, partnerships, monitoring, and actively doing outreach with unsheltered households, working with other outreach teams and providers. In essence, coming to the person in need with those resources and kind of doing that on the spot discussion with that person. Pallet shelters being a space of growth and transition, so those are not a place for a long-term placement. It really is the hope to get someone into a pallet shelter, get some stability, and then continue to help them move forward to continue to stabilize and be in a permanent place long-term. Integrate with essential services for shelters to be able to bring services to or bring unsheltered individuals to services. That goes back to that in the field response. So Auburn was really good about when they go out to the community, they bring in the other service partners with them, right? It's a coordinated approach. It's, well, I don't have this, but they have this, and let's get you connected right away. Let's do the thing that you need right now. Providing compassion, striving to put households on a path for health, safety, and housing. That is their main approach. That is where they start with the services piece, that hand, that in-person connection, that getting to know people, right? That relationship building side of stuff. The unsheltered members of the community working on actions to break down barriers, again, with them, and setting expectations to make steps to improve from their point of crisis, which basically leads into that last bullet there, is that our services are available, but when there's refused accountability in the public, we also take steps to make sure that not only is the individual protected, but the community as well when it comes to impacts to businesses, impacts to our open spaces, impacts to our public spaces. There is a balance there of making sure that there is accountability. I'm going to skip this one and go to the next one real quick because I think there was one more here. So that's the big piece about the homeless response administrator position that we're working to get online. So it really, again, is about public outreach, being responsive, helping on the administrative side of stuff. Glenn has been fantastic in taking a lot of that and will continue to oversee the program, but really having a full-time person on this. This is, for us, and probably for a lot of you, it's a ongoing issue that we hear a lot about from our communities in terms of concerns and questions. And so having more capacity behind it was really important to, again, have that full-time, boots on the ground, constant focus on it. So this position would continue to develop and manage and monitor contracts. So do all of the things that Glenn talked about, but really also have that good in-field connection to be feeding that information directly into the programs and helping us kind of flex and adapt as we need to. But again, it has been something that's been really, really positive for Auburn in having that immediate response, connecting them to services, connecting with the other service providers, and then feeding that into the program and continuing to get success stories from there. I will go back to this slide.
Can I ask you a question?
Yes.
When you were talking to the city of Auburn, did you by chance ask them if their coordinated efforts were drawing more unsheltered people from outside their area? because they had such a good program in place?
They have a lot more resources than we do from so for example, they have a community court, they have a lot more funding available for those things. So that's when I mentioned we're not exactly like them, right? We are kind of in the starting of building up some of those programs, but we definitely don't have the robustness. However, to answer your question, I think that what they try to do is when someone does come into the community, because they are so actively involved in being there at that point in time, they can help them navigate what they need to do next. That I think has made it a deterrent for people that want to come and be unbothered, because Auburn is actively responsive, and if you're in our community, we're here to help you, but we're going to continue to want to help you, and it's we want to get you moving and transitioning, and they are very purposeful and kind of continuing that constant discussion with those folks until either they are willing to move along and go into the services, or perhaps they decide that that's not a situation that they want to be in. So no, you can't avoid it, but I think that their strategy in being responsive to the extent that they can has really helped manage that.
Thank you.
Do we have actual numbers of the amount of people they're dealing with? And
I did not ask for that, but it's something that we can. This program is one of Mayor Backus's really big kind of priorities, and they did a whole community input process to kind of highlight some priorities, and so they've put a lot of thought and energy and effort to it. So I would not be surprised if they have those. I just don't have those online right now.
thank you.
Yeah. Any other questions for me? Okay, I'll pass it back to Glenn.
Great. Joint planning, that's part of our obligation and commitment under the interlocal agreement between the two cities, and split that into two parts. One is the regional plan, the 5-year plan to end homeless that the Chelan County is working on. So each city has a council member on that group, on the Chelan Douglas Homeless Task Force. The cities are going to participate in that plan update. Staff will provide feedback as well. The cities typically adopt that plan as a guidance document or as part of their comprehensive plan. And this plan is really important. We're glad to have the opportunity to participate in that process because the overall system, the health of that system is important for us to be able to place people and exit them from homelessness. So that's part of the planning process. The other part, though, is that the city, the specific directives and strategies for this program and these funds themselves. And so the cities are going to be working and coordinating on a planning process for that. But we're going to do that as each city's comprehensive plan. We will be updating each of our housing elements for that process. We have a whole slew of new requirements under the Washington State Growth Management Act that specifically deal with homelessness. So this is a really good opportunity for us to meet new requirements under the Growth Management Act, but meet our needs for doing a strategic planning effort on how should we prioritize those funds. And one of the things that the state now requires is that we're doing specific action items to develop housing for to house the homeless, to do low barrier shelters. We've been doing a lot of work on the low barrier shelter side, but what can we do action-wise, whether it's through codes or what have you, or specifically providing funding as a RFP, a request for proposals, where we can do a match to agencies. So those are things that we can consider through the process and would meet our requirements in the Growth Management Act, and we're committed under the interlocal to work together in that process. So for example, in 2025, available funds that could be made for doing a RFP, for example, for housing as a match could be anywhere between $250,000 to $450,000, depending on choices, if that was a decision that was made. So those planning processes will be moving forward. The planning process for the plan update for each city for our comprehensive plans has to be completed by June of 2026. Let's see. So, status of the pallet shelter. So pleased that so many of you could go to the pallet shelters last week. Thank you for going. If there's any council member who hasn't had an opportunity to do so, please let me know. We can set that up. So the final component of the infrastructure will be done by tomorrow. So the capital component of the last capital component will be done for our pallet shelter facilities. So the outreach team at the rescue mission is working on developed lists. We've been coordinating with them on eligibility criteria. They're focused on the most vulnerable, chronic homeless individuals in the two cities, and they'll be doing a phased approach, won't be doing everybody at once, to place those individuals in units. The focus of the shelters is people who are chronically homeless. What does that mean? Describes people who've experienced homelessness for at least a year or on multiple occasions. Many of those individuals are struggling with a disabling condition such as a serious mental illness, substance use disorder, or physical disability. So those are the first priorities, and as we have additional capacity, we can look at that. But we do have a list maintained by the rescue mission, and so that's where we'll begin. This is just, you've seen this map before, this is just the site here. And all the units are in place and improvements. The only thing I wanted to mention is if you look at the bottom left of that picture, there's a 4-person family unit. We actually have the unit and we're going to get that in place this year. What that is it's a spot as outreach workers work in the field and they run into a family. That can be a temporary location so that they can work with other providers to get a more suitable location for housing as they look for permanent housing. But we're excited to have that option available, and it'll be in place this year. So as I mentioned, we've been working on criteria. There's a high demand for these units, and so the following eligibility criteria would be observed. This is a part of an overall system. So we have 204 shelter units citywide, in the two cities, rather. Some folks will be better qualified for the congregate care units because, again, we want to prioritize the pallet shelter units. It's reserved for folks 18 and above. No minors are allowed. Units are for folks, it's for a last resort. If you can qualify, if you can be a fit for the congregate care, the bunk bed type setting, then that's going to be the first location. But if the folks with the highest needs would be in the pallet shelters. So we prioritize these folks first, people who need ADA accommodations. There are no shelter beds in the two cities except for the ones at the pallet shelters that are ADA accessible. So we're excited about that. Also, we'll be looking at focusing on women, couples, clients with animals, and the outreach folks are in the field so they know who have existing animals versus new. So folks who might go and acquire animals just to get in the shelter, that won't work. Clients who can't be placed in a communal setting, this is a big one. They may have PTSD, mental health, or behavioral issues. So these are a really good setting for them versus a congregate area. So we're really focusing on the folks initially who are in the field. We don't want transfers at this time. If you're sheltered currently in a different shelter or transitional facility, you can't transfer to these units unless authorized by the new homeless position. We really want to focus on the folks that are out there now to meet their needs first. And then at that point, after that, if we have extra capacity, we can look at transfers. So the rescue mission will receive the client referrals and determine eligibility. The no referrals will be accepted, though, for the first 30 days. We really want to focus on getting the system in place, working through operations. We're only going to do so many a week. And we really want to work on that list of chronic homeless individuals on the street before we start taking transfers. We aren't taking phone calls or applications. The whole tenet of this program is that the outreach workers in the field and the shelters know the folks who are unsheltered. And we really that was the whole focus on the program when we started with the two cities, is to really look at the unsheltered on the streets and be able to place them. And so that's the focus, is those are the entities who know best who those folks are. And so referrals will be made by the Wenatchee Rescue Mission, Catholic Charities Outreach Team, City Homeless Response Administrator, People's Foundation, the St. Francis Shelter, and then the YWCA Women's Shelter. If someone's currently housed in one of the other shelters, they can't transfer at this time. And 2 shelters are reserved for placement by law enforcement, but also we have shelters at the Rescue Mission and Congregate Care, and shelter at the St. Francis House for law enforcement as well. And that's really beneficial. Again, they're out in the street at nights when no one else is, and they can drop folks by based on need. So there are certain components that are required for folks in the pallet shelters, and these are okay under low barrier practices. We've talked with the state. And all we're asking folks to do initially in that first 90 days is we want folks to enroll in the state program so they can have access to housing. We want folks to engage in housing stability assessment planning and case management during their stay. Folks that are willing to do this and work with the more behavioral based rules of a low barrier shelter, they'll be put on a list or brought into the shelters as they're available. There is no length of stay requirement, and part of our problem is we don't have enough capacity with housing. So someone could be doing everything that we want them to, and it may take, longer than 90 days oftentimes because they're waiting for that housing spot and we need more housing. Now, with that being said, if someone's in the shelter for 90 days and they're not willing to do anything for themselves at that time, then they're probably not, at that point, there'd be a discussion with them. We care about you. We want you to make progress. You haven't taken advantage of this at this time. We're not going to put you in the street, but we're going to make a bed for you in the congregate care facilities at this time. It's not a closed door. Maybe at some point then when you're ready and there's a bed available, we could move you back into the pallet shelter. So it's prioritized really for folks to make progress. And studies have shown that the pallet shelters, these individual units versus congregate care, have the best success rate to get people stabilized and exit folks from homelessness. So contracts, our contracts that we have, the 8 contracts technically expire end of December. The county contracts expire in January 25. As I mentioned, the cities are faced with new Growth Management Act mandates. We have our new homeless position coming on board. We really want some time to talk about and do this coordinated planning with the city, with both cities, and have our new person come on board. There may or may not be changes with grant contracts. If there are changes, we would want the providers to know that early so that they potentially could apply to the county or other resources. And so for that reason, we want to extend the city contracts, and we had that conversation with the task force, the Columbia River Homeless Task Force already. We're going to take proposed contract extensions to that body in October and then to the Wenatchee City Council for consideration. That is the 20,000 foot view of where we're at today, and happy to answer any questions you might have.
So I don't really, go ahead.
I noticed at the Wenatchee Rescue Mission, they don't take minors, so do you know approximately what the percentage is of minors that are homeless, and what provisions do we have for them?
Yeah, and the focus, there are other providers that work on minors. So for example, the portion of our program that can work on that is our outreach team does encounter families with minors. And so we use the hotel motel vouchers to do that, and then we link up with Catholic family charities, and then also maybe SAGE, coordinated entry system, to get other providers engaged in that. So it's not something that our program is focused on, but we know the folks who are, and then we coordinate with them.
Thank you.
You bet. I'm sorry I don't have statistics on that.
Thank you.
Other questions?
I didn't have a question. I was just wondering if everybody in the room understands what low barrier shelters are and why they were so important for us to have in place. I mean, we do, but I didn't know. Just.
You should just let us know.
Pardon?
Yeah, just let us know if some of this don't.
Yeah, would you like me to speak to that? I can try, and other folks in the council or on the task force can add to this. So historically, a lot of facilities that do good work nationally, statewide, and in the community had higher barriers. And what was happening as homelessness increased, as the needs, whether it's mental health, addictions, or what have you, a lot of the individuals who were in that type of crisis weren't eligible for a higher barrier facility. And so we had a system where folks in that circumstance had nowhere to go to stabilize. And to expect someone who's going through that type of a crisis to go directly into housing without having any stabilization and connection to services is a really recipe for failure for them and for the community. And do we really want those individuals to continue that struggle on the streets? Or do we want to have a facility where we can work on wraparound services and we can try to get them stabilized in services and ultimately exit them into a permanent housing situation? And so that was the challenge that we faced back in 2021. The communities, the two counties had done really good work on setting up some permanent housing. They'd actually decreased the number of folks who were unhoused, but there was still this gap for chronically unhoused households in the community. And there was no way to house them in the high barrier facilities. And so that the decision at that time, and it was difficult to fund, they're difficult to place, but the decision by the two cities at that time was to move forward and specifically try to address that gap. Does that help?
Yeah. If somebody has a hand up in the back.
Please describe what a pallet shelter is.
Yeah, you bet. So it's a pallet shelter is a structure made by the Pallet Shelter Company in Everett. They're actually all over the nation. But it's essentially what it is, it's a individual unit that can house 2 to 4 folks, has heating and cooling, and it's insulated. They're easy to set up and move. And it is an individual temporary emergency low barrier facility. The nice thing, they have bunks, they have a place for storage underneath. The nice thing about the system, we have a campus at the rescue mission, so it's integrated with the campus there. Folks can then go eat 3 meals a day at the rescue mission, and there's space there for service providers to come and meet with individuals. But then they can stay in a heating and cooled environment that's safe in these units. They're checked every day, they're maintained, they're cleaned. We have, as part of our facility, we received grants for enhanced shower and restroom facilities, ADA facilities as well.
And the size of a pallet shelter typically is?
Oh, boy, I think it's between, I'm going to get this wrong, I think it's between 80 and 100 square feet.
Yeah. So, does that answer your question?
Thank you very much.
Oh.
Thank you.
Yeah, let me see.
Just a comment for me. I did do I went out there and looked at these pallet shelters, and they are very nice. There's no shortage of, materials in building these, so I was very impressed with these pallet shelters.
We did receive a number of grants for these. Actually, the pallet shelters, the majority of those shelters were purchased through Department of Commerce grants. The site work was funded locally through the local tax.
Some other questions from city council?
Glenn, Are the pallet shelters, available for the public to come and view?
That's a good question. You know, we'd have to talk about that. We don't want to, so things just thinking about top of my head, don't want to impact site operations, and parking is limited there. So that's something we'd have to consider and talk about.
Well, I only ask because of the question in the back of the room, because I did view them also. And to be honest with you, when this idea first came before us, probably like many of you, I was literally envisioning pallets screwed and nailed together. And they're actually quite impressive as far as keeping people out of the elements and keeping them safe and warm at night. And but they're not like, it's not like staying at the Hilton. I mean, it's not like we're like providing soap and little soaps and things like that. It's literally what it's for, is to keep them off the streets and safe. And it completely changed my perspective on what I thought they sounded like versus what they really are. So, maybe go online and look at one or something like that, it is totally different than what it sounds like.
So that particular company has a video of the pallet shelters, and maybe that would be good for us as the two cities to put that up on our website or something, so that people can visualize. I think it does put it into a different perspective when you can see it. Yeah, they're not fancy. They're not intended for pure comfort. They're not carpeted and curtains hanging in the windows, but they are safe and they're sturdy. And so if we can maybe provide those videos, because I agree that the space is,
It sounds like it's not,
difficult to get in. And in addition, people's privacy and safety issues and having the public go there. So
That would be a good
I'll commit
idea.
our staff to getting up something on our website and maybe through social media as well.
Great, thank you, good idea.
I think it's also important to note that these don't have plumbing. They have a communal restroom and a communal shower, so they're very, very basic.
Is there a life expectancy of these? Are you gonna have to replace them in 10 years, or do we have any idea?
Good question. I haven't heard of an issue with that, but as with any facility, that can be something we look at. What we are doing to maintain them as much as we can is that we are, there's a weekly check by the facility staff at the Rescue Mission, and then our facility team at the City of Wenatchee is there to check on anything that needs to be repaired. We have a certain number of components in stock as we need to replace things. Sorry, I don't have a good number on the life expectancy.
You're talking about possible breakage of things by accident or someone who's in there, but not necessarily the pallet shelter itself. It probably has a longer life, but you never know with someone staying there.
Correct, yes. So we want to monitor that closely on a daily basis.
And that brings a question up of what do we do with people who regularly break things or destroy things? These are low barrier shelters, meaning they can be on drugs, they can be out of control. So what do we do with people who are in there and refuse to take care of the facility?
So I can answer that if you like. Those situations will be common. So we're dealing with folks in crisis for a variety of reasons. And these are things that are talked about amongst the shelter providers. Because, like you said, they might be having an episode. And because it's low barrier, there will be things and actions that are not appropriate. And so the idea is that, so for those, that sometimes there will be times where that a warning is sufficient, versus there'll be times where they may have to be exited for that night. It's progressive though. And the intent isn't that you have someone who had an episode and then they're banned for 5 years. That defeats the purpose of the facilities. And so it's progressive, and there's a discussion with them and, you know, come back, you know, it depends what it is, you know, come back in a night, come back in a week, you know. For very severe, there are some things which are such a life safety issue where it may be that someone can't come back. Those are very rare. They can happen. But in general, it's intended that it's more progressive and that you're giving the people the opportunity to progress and they're going to revert to some behaviors that aren't acceptable over time just because of what they're going through.
But we do have a plan in place for how to deal with those people. It's not like it's just come and go as you please. There are.
Correct.
Even though it's low barrier, there are still rules.
It's behavior based, it's harm prevention based. You do, you know, you're having tough discussions to try to, and there's training that we require the providers so they can do, you know, de-escalation training, you know, harm reduction. It's a tough business, but you know, it's necessary that training's in place.
Question, I'm going to clarify because I'm not sure. They are allowed in the low barrier if they are an addict or whatever, but they cannot use on property.
Correct, that's correct.
And of course, there is a certain level of behavior that we're going to require of them, and hopefully, generally, everything's copacetic. So what you were asking about and what you were describing is if you have a situation where, you know, someone, you know, they have a bad PTSD, you know, whatever, and they get out of whack, you know, that doesn't end their stay there, but it does begin the conversation. If it escalates and it can't be managed, then he can't stay, you know, right?
Correct, and,
Yeah.
you know, for example, the RV safe parks, there are individuals who've been exited multiple times, but have now come in and they've calmed down and they've gotten through their crisis, and one individual is now in a rest home. So just because of the nature of some of the things that folks are going through, you have to have patience and realize that, you know, for some folks, you have to keep coming back. But there are rules. It's just that it's a higher threshold.
Glenn, this might be out of scope. I appreciate what we've talked about in terms of this being a void for low barrier beds in the community. And maybe this is just a perception, but it seems like there's been a large increase, say, over the last 20 years of need for homelessness services in our valley. Would you agree?
It's changed significantly, yes, and the need, and that's been a national trend. And it's not just been in the valley, it's
Everywhere.
every city, every state that has occurred. And there's a variety of reasons for that. Changes in medical care for mental health, changes in housing. You know, one of the biggest gaps is the cost of housing, and a big connection to homelessness and the cost of housing. Addictions and the new drugs that are available. So it's very complex. And yes, it definitely has increased here and nationwide.
Okay, so I understand that it's a wicked problem in housing. You know, some folks would say in larger metro areas that homelessness is a housing problem. Like if there's affordable housing more generally, then things don't trickle down as much. Are there things upstream that we as a community could be doing instead of mopping up a spill that some of our
Absolutely.
resources could be
Yeah, we
going
could be
towards?
building affordable
Yes,
housing.
and I think that's where we're at now. We've gotten the bones in place. Now we really need to work on services and service gaps. And we need to work with partners. We can't do it on our own. We can do some matches. We need to work on ways to exit people from shelter. We don't want to just have people in the shelter and think, oh, we're done. We'll exceed our shelter capacity in no time if we aren't proactive. If we don't do a better job on trying to work with in partnerships and bringing treatment programs for addictions and mental health services, for so many people that are going through that. If we don't do a better job of trying to get more housing options for individuals, a lot of folks are in a place where they can't function without what's called permanent supportive housing. They might need oversight. And we help fund a couple of those programs. So yes, it's, if we just focus on what we've been focusing on, we're not going to be successful. We have to work on our partnerships, and we have to look at how we can exit folks out of these shelters.
And so what's sort of the time frame for that piece?
It's ongoing. We consistently work on partnerships. We will be working with our new position to push those partnerships for service provisions. That's just part of it. The other part of it, though, is the planning that I mentioned. Is we'll be looking for direction in two parts. One, participating in the regional plan with the county for that overall assisting and providing our input and the public's input. But then secondly, we as two cities have the ability to really focus, here are our resources, how do we want those resources spent, and how do we want to prioritize those? So that is something we can do next year with our contracts. It's something that we can do in our updated housing elements for each of our comprehensive plans. You bet.
Thanks, Glenn.
Thank you.
Thanks for the update. What's the next step, like a city council, another update in 6 months from now? We should have another workshop. What's your thought process on this?
I think that definitely, I think updates would be beneficial. I'd love to bring the new homeless administrator to that meeting. I'll still be involved. I think we'll have some more metrics design that we can talk about. We'll be able to talk about performance targets. We'll be able to talk about the planning process for making some priority decisions. So yes, I think in roughly 6 months it'd be a great time. And I can do one or two things. We can meet together again. I can go to each council separately. I'll do whatever folks would like me to do.
Okay, great. No, that's super. And then we will figure out the videos and post it on our websites and social media. And put that out for everybody. And then other questions we're gonna have a public comment here in a minute, but other questions, should they get directed to you?
Sure.
Or is that what we want to do? Okay.
Yeah, and they could be directed to me, and then, the city of Wenatchee, whether it's a East Wenatchee question, we can route those. If it's something, Wenatchee, we work as a team really looking at this issue, and then if it's something specific to a different team member, I can route that to them.
Perfect. Thank you for all your continuous hard work, and
Right.
we're looking forward to.
May I just make a quick comment? Glenn, thank you so much. You have worked so hard. And when I think it's been about 11 years I've been involved in this now, and everything you have done, we are light years ahead of where we are, and
Yeah.
I can see significant progress, and all of your hard work is paying off. Thank you so much.
Well, thank you so much. It's been,
I'm gonna ditto that.
appreciate it.
Yeah, we've been there together.
And Linda and Shane and other task force members have been amazing in this effort, and it's been a partnership, and everybody's involved, and it's exciting to see some progress.
It's
Lot more to
really
be done,
exciting.
certainly.
Yeah, it is, yeah.
Hey, Glenn, you shared just a ton of information. I mean, I know you couldn't have broken that down and had this meeting go a little less than 3 hours. Could you share that PowerPoint with the two entities? And
Absolutely happy to do so.
thank you.
Thank you.
Great idea. Well, thanks, Glenn.
But thank you.
Thank you, Glenn.
Okay, at this time, we're going to transition to citizens' comments. It's a period of opportunity for any member of our public to address the city councils. When recognized, please come up to the microphone, just state your name and address and the matter of your interest. We do limit it to 3 minutes. So who do we have first? Anybody?
Just listeners today.
Just listeners, that's okay. Great.
What if we just want to ask a question?
Why don't you just come on up, and it doesn't mean you're gonna get an answer, but just come on, you can, come on up
Make you
and.
come up, yeah, you gotta come up
Say-
to the podium.
Yeah, we want to encourage people to come up, so, yes.
So I'm just curious, I've heard news
Could you
story.
state your name? I'm so sorry, and what community you live in?
Sure,
you.
Bryce Greenfield, and currently live in East Wenatchee.
Wonderful, thank you.
I'm just curious, I hear news stories of other cities busing their homeless people out of their boundaries. I'm just kind of curious, does that factor in to what services we provide? I guess their origin story? I mean, I don't know how to phrase it. That's it. Thank you.
Okay, we will get back to you on this. Can you?
Why? Don't we have that answer?
Yeah, no, we really don't do.
I think a lot of us want to hear that as well.
That's great. You can come up and make a comment. You have 3 minutes of time. At this point, you can do that, but we're not going to have responses back. We will definitely supply answers for anybody that wants that question. That's great. That's how.
Where can we get that information?
We will, afterwards, if you will hang on, we will get your name and
Email.
address and email, and we'll get that to you. Anybody else like to address the council?
Good afternoon or good evening. My name is Ginger. I live in East Wenatchee. Very new to a lot of this. Many of you have probably been working on this for many years. So pardon me for part of my ignorance on some of this. But part of what I wanted to know, and thank you for your question on that, is what is the transition plan for these folks who are in crisis, who go into these homes and then need to be moved out of those crisis situations? Is that posted somewhere? Is that something that community can get involved in? And secondary, I gotta think of the other question I was gonna ask. The transition plan, and in these homes, when we're transitioning them, are they also, while they're living in the homes, what parts of their responsibility are to keep these places up and running as well, right? Are they having community services as well? And that's my questions.
The question.
Thank you. Hang on after the meeting, and let's get your email and. we'll get
Yeah, and
back to
that's
you.
just another question is why I don't understand why at this forum, when we ask these questions, it can't be expressed at the very moment that we talk about it. Why is it later on and in emails?
Yeah, it's the.
I'm
forum
new
for-
to this, so-
Yeah, it's everybody to have opportunity. That's the way the process is. So,
Okay, fair enough.
thank you.
And I'll address a little bit more on why public comment, it's typical not to have a lot of dialogue and interaction. It is confusing. And so this particular forum that we have today is a workshop, and a workshop is designed for the councils to get more information. It's a learning session for them, not necessarily where it's turned back towards the community. This is a time for them to kind of ask those questions, be prepared for additional questions that they might have when there's contracts that become available, or they want to do a push out to the community and do some education. So the public input and the invitation to have your input is heard. It's just, this is a learning. They're also learning some of these things at the same time as you. And so the work sessions, the dialogue back and forth, they may not have answers for you yet because they're in that learning stage. So, yeah.
Thank you.
Yeah, you're welcome.
One thing I didn't ask, which would have been really nice, is if we could have had statistics today as well, so if we can get that information as well to some of the questions that were asked. We'd really like to know those numbers.
I didn't hear what you asked.
Her question was, can we have statistics available? And yes, if please leave your information and we can make sure we get that information out.
Hi, good evening, council, mayors. My name is Sasha Slayman. I live in East Wenatchee. I am the housing program manager for Chelan County. So thank you, Glenn and Laura, for the presentation. Glenn did such an amazing job. We are so fortunate to get to have an amazing partner in the cities. And so since I would be remiss, since there are so many members of the public here who want to be involved, part of what Glenn talked about was the strategic planning process, and the county is going to be putting out a survey actually next week where we're collecting information, hoping to collect information from the public around how much they understand about homelessness as an issue and where they get that information from. Part of what we want to understand with the strategic planning is how we can better reach the public and where people are getting information. So since so many people have these questions, tonight, since you probably have more questions for Glenn and me and Laura and others, want that feedback. So we're going to be launching that. Hope you all take it. Hope other members of the public take it. Glenn talked about coordinated entry, the homeless housing network that we manage. And at our homeless housing task force yesterday, Amber, who works with us, gave an update on that. And so I would love to share with you, we just took over that program. And so far since July, when we took over at the county, we have exited into permanent housing 9 households. So that's really exciting. Partnerships with a lot of different agencies, and folks have been moved into transitional housing. About 15 households have been moved into transitional housing. And we've helped people get connected to TBRA vouchers, and then also placed into, of course, hotel motel vouchers. So just wanted to let you guys know about some of that. So we really are very fortunate to get to work with your staff. So thank you for that. So, yeah.
Thanks, Sasha. Do you mind if people get their emails too? If they, I'm thinking some people want to
Yeah,
get
I'll
that
stick around.
survey. Yeah, that'd be great.
Yep.
All right, thank you. Anyone else?
My name is Elka Honor, and I'm a Wenatchee resident, and I came today because I have family members that are out on the streets here, and it's very encouraging to hear that there's a plan. I want to thank everybody for all the effort that you're putting towards helping find shelter for people like my brother. But I also want to speak as somebody that has witnessed what happens out here. I've spent a lot of nights patrolling the alleyways, looking for my brother. And he's nearly 40. He's spent most of his adult life on these streets, particularly. I think he went to Spokane for a couple years. We couldn't find him. But so a couple of months ago, he was in one of these tents down here by the Salvation Army under the bridge, and shooting up drugs, and he had a stroke. And they found him face down the next day after he had had that stroke, and he had no ID. Nobody knew he was my brother. Nobody knew how to get a hold of us. It was several days before the hospital got a hold of us. And my sister and I were both caregivers, and we worked really hard with him and with services provided to get him through the therapy that he needed to go, and even found housing within our family, which was very difficult, so that we could bring him in. And regardless, he left. Okay, he was supposed to, we had follow-up appointments. He'd had a stroke. It was amazing that he could even get up. It was actually a blessing that he couldn't get up there for a little while. And we thought, we got him, okay. He's not gonna go back out. He's not gonna go do that again. No, he won't do. Well, he did. He did. And so I've spent a lot of time since then looking for him. And he's left from this community to another community. And I think he's supposed to be back now. But the point is, it's hard out here. And it's violent. And it's dangerous. And I've witnessed it myself. So, as we're planning, I just hope you all are taking that into consideration for several reasons. One, because of the community. It's our community, It's better that we do have a place for them, that they're in the park, for sure, for sure. I see people with baby strollers out in that park. I hope everybody knows that, all the good wishes and all the services and all of that's great, but if they don't want to take advantage of them, they will not. And I hope that there's a plan in place for that. And I hope that some of this money is being used for resources that will actually meet their needs. And I just, there's folks out there because they want to be out there. A lot of them. I know them. I grew up with them here. And I tried to get them back around, but it's not going to get to them.
Thank you. Anyone else? Seeing none. If you'd like to come back, well, you had your 3 minutes.
No.
I just wanted to point out to Elka,
All right, we're gonna, you can talk about it here in a minute after this, if you'd like. It's not an open discussion. Anybody else that hasn't been up would like to comment? Hearing none. For the city of Wenatchee, if we can get a motion to close the meeting.
I'll move to close the meeting. Second.
We have a motion by Councilmember Osteen and a second by Councilmember Hornby to adjourn the meeting. All those in favor?
Aye.
All those opposed? Hearing none. I only can do for.
I know, yeah. Task force